am Madhurima Datta, Zoology and Biology Educational Content Creator. Now content for Class 12, CBSE, ICSE, all boards and also NEET aspirant students. Unit 1, Reproduction. Chapter 3, Reproductive Health. It is a chapter of needs and goals of national reproductive and child health. Today I will discuss about the contraception method. The contraceptive methods are designed to prevent unwanted pregnancies, and ideal contraceptive should be user-friendly, easily available, effective, reversible, and have minimal side effects while not interfering with sexual drive or desire. First, natural and traditional methods works on the principle of avoiding the meeting of ovum and sperm without the use of devices or chemicals. It is a high failure rates. Next, periodic abstinence, that is rhythmic method. Couples avoid coitus from day 10 to 17 of the menstrual cycle, that is fertile window, as ovulation typically occurs around day 14. Next, coitus interrupts or withdrawal methods. Male partners withdraws the penis from the vagina before ejaculation to prevent insemination. Next, lactational amenorrhea method or LAM, based on the absence of menstruation during the intense lactation post-parturition up to maximum of 6 months, and high prolactin levels, that is suppress gonadotropin and FSH, also LH secretion, preventing ovulation. Next, barrier method, physically prevent the ovum and sperm from meeting. Condoms, that is available for both males and females, that is femidoms, and made of the thin rubber or latex sheath. Then key need points are condoms offer protection against sexual transmitted infections and AIDS unlike other methods. Method is diaphragm, cervical caps and vaults. Rubber barriers nested into the female reproductive tracts to cover the cervix during coitus, and reusable, often paired with spermatical creams, jellies or foams to boost efficiency. Next, intrauterine device or IUDs. Inserted by doctors or expert nurse through the vagina into the uterus, most widely accepted method in India for child spacing. Unmedicated IUDs are example lips, rope, and mechanism increases the phagocytosis of sperm within the uterus. Next, copper releasing IUDs. Example CUT, CU7, Multilo 375, etc. Mechanism release Cu2 plus ions, suppress sperm motility and reduce the fertilizing capacity of sperm. Next, hormone releasing IUDs. Example progesterone and LNG20. Mechanism make the uterus unsuitable for implantation and render the cervix hostile to sperms. Emergency contraception, administration of progesterone or progesterone-estrogen combination or IUDs within 72 hours of unprotected coitus or unprotected intercourse, used to prevent pregnancy due to the rape or causal unprotected intercourse. That is detailed mechanism of action MOA. That is copper releasing IUDs, that is CUT, CU7, which is released Cu2 plus ions and increases phagocytosis of sperms within the uterus, directly suppresses sperm motility and fertility capacity. Next, hormone releasing IUD, that is progesterone or LNG20, which is render the uterus unsuitable for implications by causing endometrial atrophy and render the cervix hostile to sperms by thickening cervix mucus. Next, failure rates and examiner traps. Natural methods, that is highest failure rates due to the irregular menstrual cycle, variable ovulation timing and presence of sperm in pre-ejaculatory fluids. Next, lactational amenorrhea, that is effective only up to 6 months and post-parturition and only if the breastfeeding is intense and exclusive. Next, surgical methods, that is vasectomy and tubectomy, that is highly efficiency but reversibly in extremely poor, does not affect hormone production in libido. I will discuss about the briefly in vasectomy and tubectomy in the next classes. OCP or oral contraceptive pills, progesterone or progesterone estrogen combination takes daily for a period of 21 days, that is followed by a 7 days gap. Mechanism inhibit ovulation and implantation and alter the cervical mucus quality to retard or prevent the sperm entry. One example is Shaheli, that is developed of CDRI, Central Drug Research Institute in Lucknow, contains a non-steroidal preparation called the Centroman, that is once a week pill with very few side effects and highly contraceptive value. Next, injectables and implants. Progesterones alone or in combination with the estrogen used under the skin or as injections. Next, injectables. Example, Depo-Provera, that is progesterone acetate, that is given periodically implants, and subdermal matchsticks like rods, that is Norplant, and placed under the skin of the upper arm. Mechanism and advantages: same action as oral pills but offer effective contraception for a significantly longer duration. Next, seminal fluid or post-vasectomy, that is semen is still ejaculated after a vasectomy but it contains secretion from accessory gland, that is prostate, seminal vesicles, bulbourethral glands without sperms. Side effects of the contraceptives: while contraceptives aids population control and family planning, indiscriminate use can cause side effects, that is nausea and abdominal pain, breakthrough bleeding and irregular menstrual bleeding, breast tenderness, and increased risk of breast cancer with long-term high-dose hormonal contraceptives. Next, MTP or medical termination of pregnancy and legal provides. MTP Act in 1971 and amendments, that is legalized in India in 1971 to reduce legal abortions and maternal mortality. Safety timelines: first trimester, that is considered safest, requires opinion of one registered medical practitioner. Next, second trimester, that is 12 to 24 weeks, that much riskier and requires opinion of two registered medical practitioners. Ground for MTP: failure of contraceptive device method used by married couple, risk to the mother's life or mental health, rape or severe fatal abnormalities. Now the topic has ended.